Obamacare is about to hit critical mass.
Americans will be getting huge premium hikes in less than 2 weeks, and in many areas of the country, they will have very few options in terms of insurance carriers. But Thursday in Miami, the president defended his signature legislation.
And I have always said that for all the good that the Affordable Care Act is doing right now, for as big a step forward as it was, it's still just a first step. It's like building a starter home or buying a starter home. It's a lot better than not having a home, but you hope that over time you make some improvements.
Really, is that the best analogy for people facing 30, 40, or even 50% premium hikes? To our Fox Business All-Stars, Charles Payne and Lauren Simonetti. Lauren, are we in a starter home for our health care?
The best sales pitch I ever heard. Not. Okay, well, yeah, he compared Obamacare, and the message been to, well, at least you have a home, you can fix it up. And did you hear he also compared it to a phone, an old phone? You can upgrade your phone if it's not a Note 7. It seems like Obamacare is the Note 7, the fireproof,
the one that blew up on the plane
right now. Yeah, because what it's done, and Bill Clinton said this, it has doubled our premiums and halved our coverage. There's no way around this. How do you fix it? Government health care.
Well, I mean, I think ultimately that might be the ultimate, the single-payer thing. But I think a better analogy would have been a dilapidated mansion that looks pretty good from the outside but was the ultimate money pit rather than a starter home. And let's face it, guys, the real deal was that everyone saw this. This is not, I don't think anyone here is shocked. We talked about this as they were cobbling this together, but they were cobbling it together against the clock, against a political clock, when they could push it through without any other Republicans supporting it. And so they made certain assumptions. For instance, what's happening right now? The transitional reinsurance stuff is going away. Insurance companies can no longer be reimbursed for losses that they were taking, losses everyone knew they would take, and they're saying, well, we don't want to be part of it.
Well, there are going to be more than 30 states that lose Aetna, for example, and in some cases United Healthcare, because the insurers are backing out. So there will be no option. So you can almost see down the road, here comes the single-payer government option. Okay, fine. Why doesn't President Obama simply look at this and own the two pieces of this that people really do like? That kids are covered until they're in their mid-20s under their parents' plan, and number two, they at least have some type of coverage, and it is an opportunity, if they have pre-existing problems, that they won't get dropped. And then fix the other part.
But those are the two things that are hurting the rest of it, because young people don't get sick, right? And a lot of young people aren't getting involved in these. And pre-existing conditions are expensive. They're very, very expensive. And, you know, before, when insurance companies, when they went over 60,000, from 60,000 to 250,000, the government paid them 80% of that. So they were okay with it. Aetna was okay with it. And in fact, from March of 2010 until last year, Aetna's stock was up 262%. It was a win-win for all the insurance companies. So those two things work in public. How do you make them work from an arithmetic point of view?
Okay, so then the next question would be, Lauren, we go to a single-payer health care format. What do you think of that?
Will doctors accept that sort of coverage, right?
Oh, what will happen is there'll be a two-tier system. The VIPs will get a luxury concierge service. They'll have their own private hospitals.
For which they'll pay.
For which they'll pay, and you'll hollow it out for the rest of the people. And so these left-leaning policies do the exact opposite of what they're intended.
Right.
The middle class and the lower middle class are going to benefit from the private enterprise system that's more competitive.
And the private enterprise,
that's the shame of it.
They just can't compete. Speaking of young people, the numbers are less than 30% of the 13 million of us on exchanges are young. So young people aren't signing up. Other people are getting pushed out. United Health lost almost $1 billion on this exchange. It's turning out to be a disaster. And look, in the beginning of the administration, Obama had both houses on his side. And instead of focusing on economic growth,
the Democrats had a majority. A veto-proof majority. That's how they were able to ram it through.
Let's say the administration pulled you in and said, you're a smart guy, help us fix this.
Right.
What would you say?
Well, I think there has to be certain competitive, remove state lines. Almost as if you were to think about how come Walmart, Costco, Dollar Tree, what do they do? How do they drive prices lower? How come food prices have gone lower in the last couple of years?
But provide a quality product.
Provide a quality product, but make it a competitive product that you have alternatives. Why are we having this discussion? Because to the point, over 200 cities are going to have one carrier. You know, most states are going to have one. It's just a lack of competition means prices go straight to the moon.
You're hired.
Thank you. Anthony, can you make the introduction?
I'll make the introduction I'll make the introduction if we win. You'll be a great spokesperson. But before we go, where do you see things?
Oh, I thought you were going to ask me what I would do if I got elected.
We're going to hop in a second. Presidential campaign, where do you see things?
In terms of health care, major fixes coming to it.
Charles?
Overall, its impact, I think if Donald Trump had been talking about this for the last 2 months, when people got those premium hikes on November 1st, it would have been like Trump was right.
It is unintended consequences, certainly. Charles Payne, Lauren Simonetti, great to have you. Thanks for joining us.